Why is my hair not growing after a hair transplant?
A lack of hair growth as well as a decrease in hair density can be very distressing for people who've undergone hair transplant surgery. It's important to understand what happens to both your existing hair and the transplanted hair after surgery. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I've been performing hair transplant surgery throughout my career. I'm also the founder of TrichoStem Hair Regeneration Centers, a non-surgical stem cell-based treatment for male and female pattern hair loss. I developed TrichoStem Hair Regeneration from observations made from the application of wound healing technology to improve hair transplant results. Since 2011, we have developed customized treatments to help people with genetic pattern hair loss. The effects seen with TrichoStem hair regeneration include the reactivation of hair growth, which was not growing, and the thickening of thinning hair. This combination results in a significant improvement in scalp coverage. Losing hair soon after a long and costly hair transplant can make anyone worry about their decision to have the procedure and the future of their results. Hair transplant surgeons are often not clear about communicating to patients about the impact hair transplant surgery has on hair that's still present on the scalp, as well as the transplanted hair. A common cause of hair loss soon after transplant is shock loss. Shock loss occurs due to several factors, including the physical trauma hair transplant surgery has on the scalp. For example, if a hair transplant consists of 2,000 hair grafts surgically being implanted into the scalp, this means there are 2,000 stab incisions made into the scalp. This level of trauma causes bleeding, inflammation, and potential vascular compromise throughout the scalp. As a consequence, native hair and transplanted hair can shed shortly after the transplant surgery. This often means that a hair transplant patient experiencing shock loss can look like they have even less hair after transplant than they did prior to surgery. Shock loss is temporary. In shock loss, the hair follicle remains intact, so hair will grow with time. This is one of the reasons why you need to wait up to a year or more to see the full results of a hair transplant. A not so common reason for why hair may not appear to grow after transplant is the development of ingrown hair grafts. It's possible for hair grafts to grow inward, so their length changes very little even after a few months. In such cases, the skin needs to be just opened and the hair needs to be released to be able to grow properly. Another more significant cause for hair loss after transplant is collateral loss. This occurs when hair grafts are surgically placed close to existing hair. During hair transplant surgery, the needle, blade, or implanter can permanently damage existing native hair follicles. Unlike shock loss, collateral loss is a permanent loss of native hair caused by the trauma of hair transplant surgery. Surgeons often justify or rationalize collateral loss by assuming the native hairs are thinning anyway and will eventually be lost. Collateral loss is one reason why hair transplants are generally not recommended for most cases of female pattern hair loss, where hairs are diffusely thinning throughout the scalp, making it more likely for collateral loss of native hairs to occur during transplant surgery. In our practice, we take a different approach to hair restoration. Instead of looking at thinning hair as hair that will be lost eventually, we see thinning hair as something that can be improved to the point that the results can exceed the outcome of even hair transplant surgery. The natural density of hair is 50 to 100 hairs per square centimeter. This natural density is significantly greater than the density of transplanted hair. Generally, hair grafts can be transplanted at about 20 hairs per square centimeter. This is because of the blood supply needed to sustain the viability of the hair grafts. Exceeding this number of grafts can result in some or even all the hair grafts being lost. By thickening the thinning hair with our hair regeneration treatment, the improvement in scalp coverage reduces the area of scalp that would need hair transplant surgery. Since native hairs are much closer in density than transplanted hair, thickening hair non-surgically can achieve more coverage and hair density than any transplant procedure. In fact, in the right patient with significantly thinning hair, the hair regeneration treatment can exceed the density and coverage of not one, but two hair transplant surgeries. TrichoStem hair regeneration consists of platelet-rich plasma, or PRP, and extracellular matrix by A-cell. PRP, which is a concentration of wound healing and growth factors present in your own blood, is used in combination with extracellular matrix. There are doctors using PRP alone to treat pattern hair loss. Although there can be some benefit, we know from experience that it's not comparable to TrichoStem hair regeneration. Some doctors are using PRP with a standardized dose of A-cell. As one of a handful of doctors using A-cell since 2011, I have been treating patients from around the world and have achieved consistent and predictable results with visible long-term improvement in over 99% of genetic pattern hair loss patients, both men and women. Each treatment is customized using an algorithm I developed from years of experience factoring in gender, age of onset of hair loss, degree of hair loss, current age, and other medical therapies being used. Most patients only need one treatment session for thicker hair and fuller coverage, and results can be expected to last 3 to 5 years. Some patients with more advanced hair loss have a second treatment, which we call the booster, at 15 to 24 months after the initial treatment at no additional cost. While the hair regeneration treatment is mostly used as a standalone procedure, it can be used to help people after hair transplant surgery. I found there to be an improvement in hair transplant outcomes if I perform hair regeneration treatment between 1 to 3 months after a hair transplant. There appears to be a benefit to the hair grafts as well as the native thinning hair. I've also observed the grafts to grow sooner than they would be expected to, which means that the period of the effects of shock loss is actually reduced. The overall benefit is better scalp coverage in both the short and long term. Hair transplant surgery can be very effective, but there are limitations. It is important to have a strategy in place to maximize your scalp coverage for as long as is genetically permissible. If you've experienced significant hair loss after undergoing hair transplant surgery, there may be potential benefit from stem cell-based hair loss treatment to help you improve your final results. Otherwise, allow 1 year after hair transplant surgery to transpire and assess your final results. I hope you found this information helpful. Thank you for your question.